My name is Ryan Farthing, and this is my Capstone project video on fall prevention for NURB 499C Advanced Nursing Practicum. First, I'd like to go over my references that I used for this project. The first is from our text, Amir 2013, Quality and Safety Models, Quality and Safety Transformational Nursing Competencies. The next four are nursing articles that I used in reference that are research articles. The first is Knack 2011, Factors Associated with Falls During Hospitalization in an Older Adult Population, Research and Theory for Nursing Practice. Steinberg 2011, Healthcare Professionals, Attitudes and Compliance to Clinical Practice, Guidelines to Prevent Falls and Fall Injuries, Worldviews on Evidence-Based Nursing. Quigley, 2013, Hospital-Based Fall Program Measurements and Improvement in High Reliability Organizations, Online Journal of Issues in Nursing. Teasing, 2011, Nurses' Caring Attitude, Fall Prevention Program Implementation as an example of its importance, Nursing Forum. The purpose of this paper is a review of 4 nursing articles within the past 5 years who have been peer-reviewed and the authors are nurses. Further discussion will be on the different dimensions of research performed and the aspects of fall prevention. Information has been collected and evaluated incorporating both qualitative and quantitative nursing research. The significant nursing issue to discuss is the effectiveness of safety precautions used to prevent falls and injury in the healthcare setting. By using their knowledge, skills, and proper attitude listed in the text, Amir 2013 states, nurses can eliminate falls and continue to provide quality and safe care to patients. This capstone project has been designed to illustrate through different titles and subheadings fall prevention. Research has been performed in various studies and is readily available to the public and healthcare community. By discussing this topic, hopefully, I will bring continued awareness and importance to fall prevention in the healthcare setting. Fall prevention programs are established patient care models that aid in the prevention of falls in the healthcare setting. As stated in Quigley 2013, falls represent a major public health problem around the world. In the hospital setting, falls continue to be the number one adverse event, with approximately 3 to 20% of inpatients falling at least once during their hospitalization. Falls are preventable and can be eliminated with implementation of fall precautions that are tailored to meet the specific needs of the patient. Steinberg 2011 lists clinical practice guidelines aimed at preventing falls and fall injuries have been shown to be effective in acute care hospitals. And as a member of the healthcare team, nurses help establish and implement fall precautions. Teasing 2011 states, fall prevention programs are universally multidisciplinary, but nursing care plays a central role. Falls not only affect the patient's health, but can increase their length of stay and add additional cost to care. Knack 2011 states, falls of hospitalized older adults are of concern for patients, family members, third-party payers, and caregivers. Careful development and implementation of a fall prevention program begins with research studies. Preventing falls in any healthcare setting is the key to safe and quality care of patients. In my current clinical practice, we use the Morse Fall Plan to score patients' fall risk. These tools are completed on admission and every shift. The Morse Fall Risk Evaluation presents a numerical score to patient-specific characteristics and needs. There are several preventative measures utilized by nurses for any patient who has a history of previous falls or a low fall risk score. For example, fall risk precautions can be reduced by the bed in low position, 2 side rails up, personal items within reach, call bell within reach, fall risk band, falling star on door, and slip resistant socks. There are several other preventative measures that can be utilized to help prevent falls when other preventative measures have failed, or in addition to the aforementioned standard fall precautions. Those consist of having a family member or friend of the patient sit with the patient, and as a last result, if the patient is in danger to themselves or others, physical or chemical restraints can be used with careful monitoring. Continued education is needed for all staff who come in contact with patients. There are several ways health organizations and management personnel can do this by ensuring that staff are well educated and knowledgeable on fall prevention programs and precautions. Evidence-based practice is at the forefront of nursing standards, and the basic fundamentals of nursing are incorporated into the guidelines of patient care. Quigley, 2013, states, evidence for the most successful fall prevention programs suggests multifactorial and interdisciplinary components. Evidence-based interventions will improve standardization and process and decrease variation. There are several government and private organizations that monitor patient safety and practices in the hospital setting. Quigley, 2013, states, furthermore, the TJC, the Joint Commission, requires accredited hospitals to conduct fall risk assessments for hospitalized patients to identify patients' risks for falls so that prevention measures can be implemented into plan of care. The TJC began to monitor sentinel events in 1995, and through the end of 2012, there have been 659 fall-related events which resulted in death or permanent loss of function that were voluntarily reported as a sentinel event. There are numerous variables to discuss concerning falls within the healthcare setting, which can increase or decrease the likelihood of patients experiencing a fall during their stay at the hospital. The variables include but are not limited to the following: age, gender, environment, medical diagnosis, severity of illness, length of stay, nursing and medical interventions, staffing awareness, attitude, skills, and education, patient-specific needs, and patient's plan of care. Recommendations to continue research on fall prevention are critical to both patient safety and quality care. More data is needed to evaluate the effectiveness of fall prevention programs. There are limitations acknowledged by each study that promoted the need for more attention and importance given to this issue. But by widening the population range and limiting the variables, results can further contribute to fall prevention planning and implementation. The results of these research studies and nursing articles can be used to help healthcare organizations prevent falls in different departments and healthcare settings. By applying the information to clinical practice, nurses can help to continue further research by developing fall prevention programs, implementing fall prevention programs at their facility. Many healthcare facilities may have a fall prevention program set in place. However, evidence-based practice continues to change and adapt to the needs of the patient population. Thank you for watching my video for NURB 499C Advanced Nursing Practicum. Thank you.